to go.
Well, good morning, everyone. Good afternoon, good evening, wherever you are around the world. We are very happy that you are here joining our global showcase. This is an annual event at HHI, which is part of the Worldwide Week at Harvard. So we invite you to attend other interesting events throughout our Harvard ecosystem. And next slide, please. So my name is Irini Albandi. I'm the Executive Director at Harvard Humanitarian Initiative. And today our team will present our programs and give you more information on the work that we do. And then we will leave some time for questions and answers in case our audience have any questions for us or would like to share any feedback. So I'm starting with a number, with a quick quiz for everybody to think about what this number might mean, this 339 million number. And then I will move to reveal the number. So for the next slide. So this is the number of people in need of humanitarian assistance last year in 2023. And this is one of the reasons that we at HHI, we do what we do. This is our why, along with other considerations and data points, and that really showcase the need for humanitarian work, research, and training. So HHI, Harvard Humanitarian Initiative, we are an academic and research center in humanitarian crisis and leadership. We are an interfaculty initiative, so we work with all the schools and teaching hospitals within Harvard, and we are the humanitarian hub within Harvard and Brigham and Women. Our mission is to relieve human suffering in war and disaster by advancing the science and practice of humanitarian response worldwide. We work with communities in war, conflict, and other natural disasters. What we do is really divided into two things: humanitarian research and our humanitarian academy. Dr. Michael Van Rooyen is HHI's founder and director, and he's also the chief at the emergency medicine enterprise at Mass General Brigham. And I would like to invite him to say a few words and welcome everybody.
Hi, everyone. Thanks for joining, and great to get such a good crowd and good interest anyway. I'm really delighted that you're joining us today, and thank you for your interest in not only HHI, but in this topic. Irini answered or started to answer the question as to why, and I want to ask the further question, why Harvard? Because, you know, we as an academic institution, we're not the primary providers of humanitarian relief around the world. And yet the crucial part of what we aim to do at Harvard and HHI is to leverage our contacts, our collaborators, our colleagues across Harvard and beyond to actually professionalize and advance the humanitarian community. We do that by educational programs, by leadership development, and by research in many different spheres that you're gonna hear about today. And so one of the big kind of defining features for Harvard is that we have, and HHI, we have collaborators around the world. So we work with the world's largest and most connected non-government organizations. We work with UN agencies around the world, and we work with even governments to help them advance and understand how to apply evidence and professionalism and sort of ways that we can professionalize the humanitarian community. So I'm really proud of the work we do. I'm really just many thanks to our team at HHI for doing their really creative, wonderful work around the world. Really thankful for the students, the faculty, the collaborators that work with us, and the interesting programs that they bring to us. So thank you so much for all of you who are joining us with interest around the world, not only for your interest in HHI, but for this crucial work for, as Irini mentioned, really millions and millions of people. And we appreciate this network of collaborators and interested parties that we have. And thank you for joining us. With that, Irini, I'll turn it back over to you to run the program. Thank you.
Great, thank you. And I see our guests are saying hello in the chat from Ukraine, Hong Kong, Germany, Cambodia. So please let us know where you're logging in. Next slide. So a few notes about our impact last year in 2023. So our teams, we had 18 programs at HHI. We worked in over 190 countries around the world. And as part of our work is about training and research, we conducted different studies around the world with more than 24,000 study participants. And part of our learning network is about 17,000 learners from around the world. Next slide, please. So our work is focusing on any geographic area. It can be here in Boston in the United States, for example, with a natural disaster now in the hurricane in Florida. It can be national or regional or global, of course. And we work in any type of crisis, whether it's disease outbreak like COVID, or war, conflict, a natural disaster, or other political or human rights crisis. And our portfolio is very diverse and reflects really all the aspects of life that are impacted by a crisis. So we have programs that are focusing on gender rights, on technology, on climate, or even security. And then the communities that are really involved and are impacted by our work are any emergency affected communities. It can be specific women or children, indigenous community, and really anybody through a crisis. Next. So in terms of our humanitarian research work, we have 3 pillars. The first one is humanitarian strategies that really explore how we can advance the humanitarian field through topics like negotiation, leadership, and evaluation. Then risk, resilience, and response. And last, technology and innovation, more about technological and digital solutions. Next, please. The Humanitarian Academy, and my colleague Hama will tell you more later on, has also three pillars. One is professional education, different educational offerings for professionals around the world, online education, a few free online courses that we invite you to take, and then our educational programs for our Harvard students who are enrolled in degree programs here at Harvard. Next. So we do all this work working with other partners within Harvard University, whether it's the Global Health Institute or Boston Children's Hospital, of course, the School of Public Health, and others throughout this very rich intellectual ecosystem. Next. We also partner with people around the world, whether it's one-on-one with other policymakers, other humanitarians, or institutions, hospitals, universities, as Mike mentioned earlier, with communities. It can be an association, it can be a tribe, directly with an entire country, government, ministries, or in a region or globally, and of course with different UN, WHO agencies, or international NGOs who are in the field. Next. So here are some of the organizations that we partner with and we form strategic collaborations. Next. And then I would like to offer some ways that you can all engage with HHI. Of course, we can collaborate on our global work. You can take any of our academic course. We have visiting scientist opportunities for academic individuals. Then we can co-host events that you're all welcome, like today. You can enroll to our annual Humanitarian Response Intensive course and join any other open house and event that happens at HHI. And last, and we're offering here some ways you can scan the QR code, you can visit our website, you can follow us on social media, and subscribe to our mailing list so that you stay updated with our work. So thank you, and then I will invite the next team member to present their program.
Sorry about that, we had a glitch on the slides. Okay, so next up we have Karima from Building a Better Response, who will be presenting their program.
Hi, Building a Better Response program, BBR for short. The mission for this program is to provide foundational training in the international humanitarian coordination system for NGOs and others who wish to improve their coordination in disaster response. We have 6 modules, starting with Foundations of Humanitarian Action, the International Humanitarian Coordination System cluster approach, planning and funding, international law, humanitarian standards, and complex humanitarian emergencies. And these go like through revisions every 2-3 years based on the humanitarian architecture. And we have a large team. This is led by Dr. Fong Pham and Dr. Patrick Wang. And then we have a bunch of staff members, starting with Roger, who's our senior instructional design designer, and I have his LinkedIn profile linked later on in the slides. If you have any questions about content design, please feel free to reach out. Then myself, William, Kofi, Luciana, who's also here. We have Doe, Michael, and Jackson. Next slide, please. Just wanted to, before I get into the weeds, BBR is being funded by USAID's Bureau for Humanitarian Assistance, and we have partners that are International Medical Corps and Concerned Worldwide. BBR offers its full course in English, French, Arabic, and Spanish, and we also offer other languages such as Ukrainian, Polish, Turkish, Dari, Urdu, Portuguese, and Russian. We also do a humanitarian focus video series, which is also relatively new. It's up on our website. Here you'll see experts talking about various topics such as cash transfer, climate change, COVID-19, food insecurity, and negotiation. You can use the website to look at these. So this year we reached our milestone 100,000 users. As of August, we have 100,000, a bit over 100,000 users, and we are very excited to see where this goes. Our top 5 countries include United States and Syria, and I think we've tapped into almost every country in the world. And here's the website. So you have the QR code. Please check out our courses and enroll today if you're interested in responding to the humanitarian crisis. If you have any questions, here's my email. There's Roger's email too, who's the senior instructional designer, and Roger's also linked his LinkedIn profile if you have any other, if you want to connect or just learn more about the project. Thank you so much.
Thank you, Karima. Next up, we have Hama presenting the Humanitarian Academy at Harvard.
Thank you, Amani, and good morning, good afternoon, good evening, everyone joining us from all around the world. I'm happy to share with you some information about the professional education offerings of the Humanitarian Academy at Harvard. Throughout the year, we offer 4 professional education courses that I will briefly talk about each one of them. Irini already mentioned the different offerings for online education and on Harvard students, so I'll focus on this particular aspect of the academy. Starting with the Humanitarian Response Intensive course. Next slide, please. This course is offered usually towards the end of April every year. It is mainly targeting the humanitarian professionals from all around the world. And the curriculum addresses the main frameworks in the humanitarian field, such as human rights, livelihoods, international law, humanitarian international law, that is. It also focuses on practical issues that arise in the field, things like WASH, for example, shelter, camp management, so on and so forth. And then it also addresses the civ-mil interactions within humanitarian field. This course's length is 2 weeks, and it leads up to a fully immersive simulation, one of the probably biggest humanitarian simulations in the world that is offered in the woods. And that's where the didactic portion of the class leads up to. It's a very fun simulation. It's a kind of eye-opening, great learning experience for all the participants from all the feedback that we've been receiving throughout the years. The second course, the Monitoring and Evaluation for Humanitarian Programs, is offered usually in the first or second week of June of every year. This is a 5-day course that addresses the principles and methodologies of monitoring and evaluation for humanitarian program and the practical application of these methods in research and for practitioners. This course is offered for professionals involved, obviously, kind of a focused area involved in monitoring and evaluation in humanitarian programs. So the barcodes or the QR codes and the emails that are on each slide, I hope you have enough time to either scan them or just write down the emails. I will also share my email towards the end in case if you have any follow-up inquiries. The third course is offered in the fourth week of June. That's kind of the same month as the M&E course, is the Geospatial Technologies workshop, the Humanitarian Geospatial Technologies. This is also a 5-day course that targets all NGO and UN workers. Also targets journalists around the world who are particularly interested in doing spatial technologies work. This course addresses technologies and analytical methods in the humanitarian sphere. And these are the methods that are used now or potentially in the future in the humanitarian and disaster disaster response sectors. And then the last course in the year that we sort of wrap up the year with is the Urban Humanitarian Emergencies course. This is a 4-day course that addresses issues and best practices in the urban humanitarian emergencies space. It involves research, it involves practice. It also offers an urban walk during the course. This course is offered to or targets NGO and UN workers and anyone who is working in the disaster preparedness planning space. Again, as I mentioned, the QR codes and the email address for each of these courses were mentioned in the slides. But if you have any questions, any follow-up inquiries, please feel free to contact me directly in the next slide. This is my email, HAMA_OTHMAN@hsph.harvard.edu. Thank you very much for your time, and I'm gonna pass it on to our next presenter. I think it's Dr. Sylvia Kellenberg.
Thank you. Yes, hi, it's great to have so many of you from all over the world with us today. My name is Sylvia Kalenbrink, and I'm an endocrinologist at Brigham and Women's Hospital, and I lead the Non-Communicable Diseases, or NCDs, in Crises program at HHI, with a focus on diabetes. Next slide, please. So why diabetes, you may ask? Well, it is one of the greatest public health challenges of our time, with over 500 million people globally with diabetes, of which about half are undiagnosed still, and the vast majority live in lower and middle income countries. And on the right, you'll see the parts of the world where the projections are for the most dramatic rise in diabetes over the coming decades. There are some estimates that 1.3 billion people could have diabetes by 2050. Next slide, please. And in parallel to that, the number of people forcibly displaced are expected to surge to potentially 1.2 billion people also by 2050 due to climate change and natural disasters. And you'll see here on the map the parts of the world that are, the hardest hit overlap almost directly with the areas of the world most affected by diabetes. Next slide, please. However, well, I should say that humanitarian crises pose a huge risk for people with diabetes, especially those with type 1 diabetes, but in general can exacerbate the disease and long-term outcomes. However, most organizations are struggling to provide diabetes care, and it's not routinely included in operating procedures and minimum standards for humanitarian assistance. And NCDs overall are probably the most underfunded issue in global health. Next slide, please. So because this is a massive global issue that extends well beyond any one single organization to fix, we started an alliance of over 130 organizations called the International Alliance for Diabetes Action, or IATA for short, which is essentially a collective impact initiative with the mission to improve access to high quality diabetes care as a tracer, as like an index NCD for people in humanitarian crises. And we have 5 different working streams, one on leadership and collaboration, one on improving service delivery, one on access to medicines and diagnostics, another on data and research, and finally one on financing and policy. Next slide, please. And these are all of the organizations that are collaborating, providing their expertise, their knowledge to this initiative from different sectors. Next slide, please. This is our team. I direct the program, and we have 2 team leads per pillar, per working stream that help coordinate the work. Next slide, please. This is just an overview of some of the projects within the different working stream that we've done, various research projects, technical background papers, working on treatment guidelines adapted to low resource settings and humanitarian settings. Next slide, please. And we host an annual symposium where we bring everyone together to help set the agenda and move things forward and build relationship and help this network work effectively. So that is it. If you'd like to get involved, that's my email and that's our website. And thank you all for listening.
Thank you so much, Sylvia. Next up, we have Dr. Sean from the Emergency Health Systems Program.
Thank you, everybody, for joining, and I'm excited to introduce you to our Emergency Health Systems Program today. And this program was started about 5 years ago in response to an identified need in gaps in emergency care systems and preparedness around the world. Our mission is to strengthen emergency care globally, and we have 3 main overarching goals, of which there's many objectives within these goals. But our 3 goals are to improve and increase the technical sharing with frontline providers worldwide. A lot of decisions and guidance gets developed at high levels like the WHO or other organizations. But one of our goals is to get that guidance to the people providing care on the front line, and also to collect the feedback from the frontline providers using it and how we can improve this guidance around the world. Our second goal is to improve processes related to emergency care delivery, and there's many of these from the continuum of care, from the incident of injury or illness, all the way to definitive care and rehabilitation, and ideally re-entry into that person's life from how they were before the injury or illness. And every step along the way, there's process measures that we work to improve. And finally, our third goal is to support the dissemination and implementation of locally appropriate emergency care guidance. And this is probably the vast majority of our work that we do around the world, which I'll show a few examples. Finally, and most importantly, is the localization aspect of our work. We recognize that emergency care delivery varies widely around the world, and our goal is to really elevate the local voice and expertise and experience in these discussions at all levels so that we can create as contextually appropriate and useful guidance as possible, so that in the end, we're improving the experience for the patients who need emergency care, who are our ultimate goal and priority. The reason that this emergency care systems work is built within Harvard Humanitarian Initiative is because there is a direct relationship between humanitarian response and emergency care system preparedness and delivery. And as you can see here, the strength of an emergency care system directly impacts the effectiveness of a humanitarian response. So a strong emergency care system has the resilience and the scalability to quickly adapt and respond to surge, whether it's a natural disaster or a conflict or a mixture of the two. And conversely, any effective and strong humanitarian response involves the strengthening of emergency care systems. This allows the building of resilience and local workforce and expertise to better prepare for not just the next humanitarian crisis, but also the day-to-day emergencies that happen in all societies to all of us. In many ways, experiencing an emergency event is a commonality between all of humanity, that all of us will get sick or injured at some point in our lives and our families. And that's why we must work together to have this response. We do this on every level, local, global, and everything in between. This is just some highlights of some recent work that we do. We work with many partners, UN agencies, NGOs, governments, and academic institutions around the world. And one of our larger programs is focused in Ukraine, and where we've been training frontline providers in providing trauma care and surge response and chemical, biological, radiation, and nuclear preparedness. Doing trainings in Jordan for the in partnership with the World Health Organization for the Eastern Mediterranean region, where we trained humanitarian leaders from over 50 countries last winter, working with International Medical Corps and WHO in Somalia, doing basic emergency care training and mass casualty training, working with residency training programs around the world in Nigeria and Rwanda and Botswana and many other countries to improve the quality of emergency care and support educational initiatives, and working with frontline providers and public transit drivers. One example is a recent program in Tanzania where we trained the public transit motorcycle drivers in first aid and found shortly after that they were responding to accidents every day by default, just by the fact that they're on the road and encountering them. So we work with all levels of the system, professionals and bystanders, and with local partners and global partners to try to improve the access to emergency care for people around the world. Our team is growing, and I'm Sean. I'm an ER doctor at Brigham, is my day job, and I lead this program along with Catalina Gonzalez Marks, who's also an ER doctor with me at Brigham, and Katie Murray, our program manager, who has really built this program and organized it and advancing it, and Leah Sino, our program coordinator, who has been driving many of our local programs and partnerships. Additionally, on our team is Dr. Morgan Broccoli, who is an ER physician at Brigham and also works close with WHO, Dr. John Strong, another ER physician, Erica Nelson, and Donnell Harvin, a visiting scientist and public health expert who leads our CBURN programs. And we host several fellows and practicum and graduate students every year. We have a global emergency medicine fellowship program for ER doctors based at Brigham, and these are our fellows on the left. We also regularly host both practicum students and postdoctoral students at the Harvard School of Public Health. Currently, we have Dr. Anna as one of our doctoral DRPH students, and Michelle Gannett is one of our MPH practicum students. So if you're a student and interested in getting involved in our work, there's many opportunities to do that. Also, we host a number of webinars, and one in particular is around the emerging threat of CBURN, chemical, biologic, radiation, nuclear, explosive threats in the world, and the overlap with humanitarian settings. And one of our upcoming webinars that anybody's welcome to join will be held on November 12th, and we'll put a link for that in the chat. So if you're interested in that work, that's another emerging area of growth. Thank you so much. My email is here. We'd love to work with you or hear any feedback, so please email anytime. Thanks again.
Thank you so much, Dr. Sean. Next up, we have Kofi presenting the National NGO Program on Humanitarian Leadership.
Thank you, Amani, and thank you, everyone, wherever you are, for joining us today. My name is Kofi Nyakon. I am the Research Program Manager for the NNPHL, which is the National NGO Program on Humanitarian Leadership, and I'm very happy to share with you our work. Our mission is to provide dynamic and relevant trainings that help humanitarian professionals working at the national NGO levels to build their skills and confidence so that they're able to take on leadership responsibilities within their respective humanitarian organizations. And our main goal is to strengthen their leadership capacities, especially in three main areas, which is centered around self-awareness, decision-making, and the ability to influence their teams in ways that connect them with their purpose as humanitarian professionals. So NNPHL is implemented in partnership with Concern Worldwide and International Medical Corps. And it's also funded by the USAID's Bureau for Humanitarian Affairs, which means that these programs are offered free of charge for our learners and humanitarian professionals. So what we do, we have different streams of work. The first is the blended learning course, which is a 3-month blended learning course, which includes online learning, 2 to 3 day remote intensive training. And then there is a participant-led knowledge sharing with just after the intensive remote workshops. And then we have the online course, which is open access and has most of the courses that we teach in the blended learning because the blended learning requires application, which means it is competitive. But we have the online course to also make up for any one of you humanitarian who would like to learn this leadership frameworks that we offer. And then we also do in-person leadership summits. Recently, we had one in Summit, which was for our alumni. We have a very vibrant community of practice. We have webinars inviting our alumni to share their work, also doing a lot of research. We have a few publications that relate to humanitarian leadership within the humanitarian system. So our core elements includes adaptive leadership, which is the idea that everyone can exercise leadership and that leadership is an activity. And then we also look at resilience for humanitarian professionals, just not discounting the complex environment that humanitarian professionals find ourselves in. Next slide, please. Next slide. So here's a few highlights of our work. We've also have a good reach across the globe, but just to highlight that this course is really important because a lot of organizations are really requiring this as part of their training, and so I will entreat you to also start looking at NNPHL as part of your onboarding processes, your annual trainings, because we have 60% of our online learners all saying that this is a very important course for them, which is part of their learning processes. We have, next slide, please. And I think that's all. So this is our team at HHI, which is led by Dr. Vincenzo Boletino, myself and Luciana Wozniak as the project manager. You can visit our website to learn more about our program, and please do not hesitate to let us know if you have any feedback, any question regarding NNPHL. Thank you for joining us, and over to you, Amani.
Thank you so much, Kofi. Next up, we have Dr. Jocelyn Kelly presenting the program on gender rights and resilience.
Hi, everyone. Good morning, good afternoon, good evening, and thank you for joining us today. I'm presenting on my program called the Program on Gender, Rights, and Resilience. Next slide, please. A brief word about our mission. It is to examine the unique vulnerabilities that can be exacerbated by crisis and conflict, including the gender dimensions of those vulnerabilities. That can include gender-based violence, human trafficking, other forms of exploitation and abuse, and economic insecurity. And as we try to understand sources of vulnerability, we also look for sources of strength, resilience, and expertise, and use those to understand the most effective ways to address these issues by elevating the voices and knowledge of those most affected. Our program collaborators are women, men, and communities affected by crisis, as well as women's rights organizations who are supporting collective action around human rights and conservation in fragile contexts. So a brief word about our key collaborators. We've been really fortunate to have very long-term partnerships with grassroots NGOs in many of the areas that we work, particularly in Central Africa. Some of them are listed here, and for the sake of time, I'll kind of move beyond, but just to note that we have been really lucky to often have decades-long kind of ongoing collaborations with many grassroots NGOs who are kind of at the forefront of addressing humanitarian crisis and climate change. So just a brief word about some of our topic areas that we tend to address in our programming. We look at gender, climate change, and conservation, thinking about the kind of global threat of climate change and how we can better address that while also elevating human rights and equity. We look at how to promote equity in the humanitarian programs using evidence to promote the argument for its importance. And finally, the topic area that has been a through line throughout all of our project and programming is understanding the root causes of violence, including gender-based violence and human trafficking. We always try to do what I like to call translational research, where we really put an emphasis on informing practice and policy at local, national, and regional levels. We were lucky to do a project with UNICEF where we looked at how better to measure the risk of gender-based violence and humanitarian crisis. That guidance is now available with a video on the Interagency Standing Committee website or IASC website. I'll put the link in the chat. And so any of you practitioners out there who are interested in improved measurement and understanding how to mitigate the risk of gender-based violence and humanitarian programs, we'd love for you to check that out. Recently, we've been doing a lot of work on the gender dimensions of forced displacement, and that's been in collaboration with UNHCR, the World Bank, as well as many partners in Central Africa. I wanted to note that the research has directly informed the UN Secretary General's high-level panel on internal displacement and is featured in a number of World Bank publications. Again, I can put the links in the chat for any of you who are interested, and keep an eye out. There's a special journal issue that highlights this global work with scholars from around the world who are contributing to this evidence base around the gender dimensions of forced displacement. Finally, I'd like to highlight the work that we're doing around gender, climate change, and conservation in collaboration with some extraordinary partners in Eastern Democratic Republic of the Congo. We've just launched a project to support women in small-scale mining towns to advocate for better environmental practices as well as improved human rights. This is a locally women-led project where the Program on Gender Rights and Resilience is supporting them to create M&E systems and training materials that can advance their mission to make sure that the green transition is also a just transition. And we're doing that by creating a women-led evidence-based intervention called resourceful empowerment. Next slide, please. Our approach is to take a really human-centered kind of design to this intervention where we had a female Congolese comic book artist create all of the materials for this intervention. And we wanted to make sure that training was cost-effective, sustainable, and inclusive, because it really is meant to be a way to support local communities looking to fight climate change with women really at the center of those leadership groups. So for those of you who are interested in learning more or engaging, I'll put links in the chat. Please stay in touch. Please check out the website for the Resourceful Empowerment Curriculum. And thank you so much for your attention and for joining us today.
Thank you so much, Jocelyn. Next up, we have Peace and Human Rights Data, Evaluation and Technology. I think Dr. Fong Pham is with us, and she's going to be presenting.
Thank you so much, Amani, and thank you everyone for joining us here today. So I have the pleasure of representing our team, presenting 3 strands of programs: the Peace and Human Rights Data programs, the evaluation projects, as well as the technologies focus. Our common mission is to work with communities and organizations generating locally driven insights to inform decisions, transform processes to emergencies, and drive positive change around the world. And I'll be presenting with you a series of projects that represent all of that. And the common core values is really the data strands, where we do use a lot of local data, collect data to help inform our programs. And there's a components of community engagements and local ownerships. And we try to also work with our key stakeholder to build policy space to bring new evidence. And then the final strand is always trying to figure out new and better ways of doing things. Why we are doing this, as you can see right now, we have the highest number of conflicts since World War II, and the highest number of casualties in the past 3 decades. 2 billion people are affected by war and violence, conflict. 1 in 6 people live in active conflict zone. And some of the conflicts are becoming, and contexts are becoming more complex. There's issues related to fragmentation, technology, climate change, criminalities, and multilateralism. Next slide, please. And so I think given that context, we have one main programs, the peace and human rights data, but we've spun off and have created two other strands that focus on one on Kobo Toolbox. We co-founded that software to help our partners and people around the world collecting data and also manage their data. The other one is the Data Pop Alliances that deals with big data and policy issues. And then more recently, we've created programs on outbreaks and in complex emergencies. Next slide, please. So on our peace and human rights data, this program started about nearly 25 years ago when we were both, Patrick Bink and I, who are the main researchers behind this major projects, in partnerships with many others. We were based in both Rwanda and the DRC. And I think what we were seeing there was a lot of the programs were not focusing on the local communities and assessing their needs and wants. And so what we did was we created this projects to try to understand the impact of conflicts, violence, and human rights violations on affected community. We also tried to explore how conflicts affect social cohesion, trust in institutions, and the broader societal implications of human rights abuses. And then we tried to capture the understanding of community perspective on justice, accountability, peace processes, and the effectiveness of humanitarian interventions. The goal here, as I mentioned earlier, is to inform policy and practices that promote peace and justice in conflict-affected area. These are a sample of all the countries that we have been working on. Next slide, please. And as part of that, we have partnered with the Carr Center at the Kennedy School of Government, as well as University of Toronto, to create a program called Transitional Justice Evaluation Tool. You can find out more about this on the TJAT websites. And our goal here is to advance evidence-based, victim-centered transitional justice. And what you see here is a recent conference that we organize with all of our partners, donors, and major policy stakeholders, and where we presented the latest research on transitional justice. Next slide, please. And more recently, we have done on those two projects, we've collected both macro data and micro data, both in Ukraine and Ethiopia. Here you'll see that we presented the slide to some of the key people who are working on the transitional justice issues in Ukraine, and then also some of the publications that results in that in foreign affairs. Next slide, please. Given the strong partnerships that we have been working on the grounds and over the years of experience of working in collecting data, we've began to now partner with different institutions and have helped create some of the basic guidelines of developing peace building measures. And that now has been spun off into a peace building impact hub that has recently been launched based at the UN agencies. And their core project is actually to measures and understands the population's need with regards to peace building and reconstructions. Next slide, please. As I mentioned earlier, two other projects that was spent off from the peace and human rights data was Kobo Toolbox. Kobo Toolbox is now one of the leading software that is being used worldwide to collect data, not only on issues related to humanitarians, peace building, but now also in the health and the international development sectors. that now is an NGO on its own. And then another initiative that's spun off was the Data Pop Alliances that we established with both ODI and MIT. Next slide, please. So here's a slide that just kind of shows those two programs. Next slide, please. And then our last project is really working on evaluations and implementation science. There, we partners with organizations such as UNICEF and UNHCR to evaluate their programs, but also to develop tools and methods to evaluating really complex, large, multi-national programs as well. Next slide, please. So these are some of the, publications that has resulted in that programs besides the programs report. So this recent one focused on using a respondent-driven sampling to assess vulnerable and hidden populations. Next slide, please. And then finally, because we work in some of these complex, there's been major health issues that had occurred in those locations. And because of we had a really strong data team there, we have supported several major outbreaks, starting with the Ebola outbreak in West Africa, then the Ebola outbreak in the DRC, as well as more recently COVID and the Mpox disease. And I think next slide, our next presenter is going to present our new projects. It's called the Local Engagements and Response Network to Learn projects. So I'm going to hand it over to Maple, who's going to present that.
Hi, everyone. I'm Maple. I am a physician and a program manager for Learn here at Harvard Humanitarian Initiative. Next slide. So Learn, we have a team here, Dr. Fong Pham, who you've just heard from, Dr. Patrick Fink, Dr. Eric Nillis, who are directors of research and director of the program of infectious diseases and humanitarian emergencies, respectively. Next slide. So the project in brief, our goal, local and national NGOs have been best placed to overcome some of the greatest challenges of public health emergencies today. A lot of national and subnational LN NGOs, first responders have limited opportunities to strengthen their technical and operational capacity to implement ID or infectious diseases responses and readiness as a multi-sectoral response, and they face barriers to fully participating in country and regional preparedness and response platforms. In addition to this, the involvement of non-health actors in the ID response has often been overlooked, while these interventions can significantly reduce morbidity and mortality in an outbreak. Despite significant efforts to conduct multi-sectoral plans for pandemics or epidemics, limited tools are available at the moment to guide the multi-sectoral approach, with every sector responding parallel to others. So coordination is a big issue. In response to these challenges and drawing from the lessons of COVID-19, Learn is hoping to strengthen the technical and organizational capacities of AT-LN NGOs and establish and or support networks of local first responders across 14 countries in Sub-Saharan Africa, the Middle East, and North Africa. Over the next 5 years, our goal is to improve the timeliness, reach, and coverage of readiness and response efforts during the ID outbreaks of epidemic and pandemic potential in humanitarian settings. Our project began back in October 2023. And so we're about at our 1-year anniversary at the moment, and we'll run through to September 2028. You can see here in this map that I've documented that we've got 14 countries across East, West, Central, and North Africa and the Middle East. Our 14 countries are Cameroon, CAR, DRC, Ethiopia, Iraq, Lebanon, Libya, Nigeria, Mali, South Sudan, Sudan, Somalia, West Bank, Gaza, and Yemen. On the next slide, you can see here, this is a workshop we did with Malians. We worked with USTTB, a national and very strong university in Mali. And we were in Bamako doing a validation workshop with them. Our three components here with Learn is we're looking to strengthen the capacity for improved engagement and coordination of LFR networks with critical ID coordination platforms. We want to improve local and regional organizations' operational capacity for readiness and multi-sectoral response to ID outbreaks. And we also want to strengthen the resources and tools that are needed for localized, contextualized, and integrated multi-sectoral readiness and response for ID outbreaks. The ultimate goal being that this is hopefully going to be a resource hub available to people beyond the lifetime of Learn. You can see here in the icons, these components are going to be achieved through a multitude of elements, including training and learning opportunities, providing technical assistance, engaging communities, developing plans and lessons, and developing a curriculum for each of these countries, including having tailored curriculum that is appropriate for the localized context, and creating a toolkit. And across all of this, we have a cross-cutting element of One Health. So this is a little bit about Learn. I know we're reaching the end of time, so I kind of rushed through it a lot, but you can get in touch with us anyway. My email is mgoh@hsph.harvard.edu. Alternatively, if you email Amani, she can definitely forward you to me if you want to talk about any of these projects or any of these countries and Learn. Thank you very much.
Thank you so much, Maple. Just for the sake of time, if anyone has any questions, please do feel free to reach out to the programs directly through their emails, or you can email us at hhi@harvard.edu and we can direct your questions to the programs. Please do follow us on social media, on LinkedIn. You can stay tuned on our YouTube channel to view the recording of this webinar later, and do subscribe to our newsletter to get our latest news, publications, webinars, and events. And lastly, I will hand it off to Mike to say a few final words. Thank you, everyone.
Thank you, Amani. Thank you to the whole team for these great presentations. You know, it strikes me a couple of things. First of all, our reach is all over the world, and it's really exciting to see all the people you've chimed in. Greetings from Ethiopia and everywhere around the world. It's been great. So thank you so much for joining us from every time zone. Thanks to the team for their, not only the amazing presentations, but really the amazing work. It just shows how complicated and interlinked the humanitarian sector is, and how much work there is to do. And so we're really delighted to be involved in all of this span of programs, which is so interesting. And we really thank you for joining us and being part of HHI. Please, as Amani said, follow us, jump in, get more information. Please, there's a lot of work to do in the world, and we're really delighted that you have an interest in the humanitarian sector and HHI. So thanks to everyone for joining us, and have a great rest of your day.
Thank you. Thank you, everyone.